Good evening. It's good to be here tonight, and it's always interesting coming back and seeing how things change. This place was a lot smaller the last time I spent any time here. For full disclosure, I did not support passage of the Affordable Care Act. I believe that what the country needed was health care reform. Our health care costs are unsustainable. Medicare, Medicaid, the Affordable Care Act, the employer-based insurance. We have a problem with costs and sustainability. I sort of likened the way we did things by sort of like our healthcare system's the Titanic. It's sinking because of its costs. So we added 30 million more people onto it, and it sinks further. But at the same time, it is absolutely critical that we did reform the insurance system, whether it was getting rid of pre-existing conditions in medical underwriting or providing subsidies for people. I just felt that if you're going to expand the entitlement, you ought to do it in a way that you also make the system sustainable. Now, Senator Kennedy was fond of saying over the years, politics is the art of the possible. The Affordable Care Act is what was possible. So in that sense, it's progress. Now, what I do for a living is I advise people in the business of health care, whether they run an HMO or an insurance company, or whether they run a drug company or a hospital system. Sunday morning, I gave the keynote address at a large physician conference in Washington, D.C. So my job as a business person, dealing with other business people in the healthcare arena, is to be pragmatic. This is the law of the land. We've now got to implement it. Now, a number of you probably really don't like Obamacare, and you're going to vote Republican to try to get this thing overturned. What I just remind everybody is Barack Obama is going to be in the White House until January of 2017. If the Republicans sweep the elections in 2016, the presidency, the House, and the Senate, and they come in 2017, repeal Obamacare, put in their own prescription for Medicare and Medicaid reform, it's going to take them 2 or 3 years to implement it. When the Republicans passed the Part D drug benefit in 2003, they didn't launch it until 2006. You don't just turn the switch on. The Obama administration's been working on implementation of this program since 2010. So it's going to be almost 4 years. So the Affordable Care Act is with us until at least 2019 or 2020, whether you like it or not. In the business of healthcare, whether anybody likes it or not, it's our job now to make it work. Understand what it is and make it work. So hopefully tonight, if I can help you, it is from that perspective. If you've come here to understand what it is and how it's going to work, I can help you. If you've come here to tell me what's wrong with it, I can sympathize with you. But it's the law of the land, and it's going to be the law of the land for the next 6 or 7 years. This is going to be implemented, and we have to do the best job we can to make it work. Now, this law is going to be implemented over a healthcare system that is going through dramatic changes as we speak. For years, our healthcare costs have been out of control, escalating way too fast. The average cost of family health insurance in the United States provided through an employer is $15,000 a year. $15,000 a year is what average employer-provided health insurance costs. And we've already started to implement a lot of things in the market to make it work differently. One of the things that's likely to change in the coming years is we'll move away from the so-called fee-for-service system, where doctors and hospitals are paid more piecemeal than for an outcome. Without a question, we're going to have lots of change going on in the system coincident with the Affordable Care Act. If we're really lucky, the things that are going on in the marketplace and the things that we're experimenting with in public policy in terms of providers taking more risk and being more responsible for outcomes, if we're lucky, all of those things will come together and this will work out. But it's going to be a very difficult period of years as we go forward. This doesn't work very well in terms of me to follow my own slides. But the Affordable Care Act was supposed to insure another 30 million people, about half of them in Medicaid and about half of them in the insurance exchanges. Well, we're here to talk primarily about the insurance exchanges. Here in Wisconsin, the issue of Medicaid and the insurance exchanges is integrated like in no other state, because your governor and your legislature have decided not to implement the Obama Medicaid expansion and not to implement the exchanges, but rather let the federal government come in and do the exchanges, and at the same time put many of the people who would have been under Medicaid and under the Affordable Care Act into the exchanges. And so here, like no other state, we're going to have a hybrid experiment, one that's very controversial, and one you'll hear more about as this conference goes on, I think. It'll be very important to how Wisconsin actually experiences this. Now, in the exchanges, people who don't have health insurance, people under the age of 65 who are not eligible for Medicare and don't have health insurance through their employer will be able to go to the exchange and buy it, individual health insurance, if you will. One of the big debates about the Affordable Care Act is what the Affordable Care Act, or Obamacare, is going to do to the cost of health insurance, particularly in the exchanges. This is a map, and you're not going to be able to read the tiny numbers, but what I wanted to point out is there are a great many estimates out there about how this is going to impact the cost. And it's going to impact the cost differently in different states. The dark red states are going to have the Society of Actuaries has projected will have the biggest cost hit because of the Affordable Care Act. The darkest states, the least so. And you'll notice Wisconsin is one of the states projected to have the biggest increases. And that's because the Affordable Care Act sets very high standards for what a package of insurance looks like. Some states have more regulation than others. A state like New York is a very highly regulated state. And as a result, the likelihood of its insurance rates increasing significantly is much lower than a state that has far less insurance regulation. In other words, if the stretch to get to Obamacare is a big one, you're going to get hit by greater rates. The projections here in Wisconsin are that this will be one of the states that gets hit hard. Here's another estimate of what those rates might look like. This is done by a centrist group, a group run by conservative Democrats, if you will, pretty much the center of the political spectrum. They went out and hired one of the big actuarial firms to estimate what costs would go up in a number of states. Wisconsin was one of the states that they estimated. And as you can see under the Wisconsin line, the cheapest plan, the so-called bronze plan in the exchange, the increase won't be too great, but that's not a package with a lot of benefits. But if you go to the silver plan, which is the core plan in the exchanges, you might be paying 50% more for health insurance than you might have been otherwise. Now, to be fair, what you paid in 2013 for individual health insurance was what you paid for health insurance when you passed medical underwriting and pre-existing conditions. Those things are outlawed now. And you will have a much richer benefit package. So to be fair, you will pay more, but it'll be in a different kind of system for more benefits. But critics of the Affordable Care Act would say, well, that's fine, but gee, I wish I could keep my Chevrolet plan. And if you'd let me keep my Chevrolet plan, the rate increase wouldn't be as great. Because while the Affordable Care Act is a great deal to improve affordability and access to insurance, it also requires everybody to have it's probably inappropriate to say a Cadillac plan, but you might have a Chevrolet and relatively this might look more like a Cadillac plan. And so lots of folks are saying, let me keep my Chevrolet. After all, didn't the president say, if you like your insurance, you can keep it? There will be a number of people who will get letters from their insurance company this fall saying they can't keep the insurance they've got now because it doesn't comply. And that will be an issue, and it will be unpopular, and it will undercut the popularity of the Affordable Care Act as a result. Now, the Affordable Care Act also, where most of the money in the Affordable Care Act is spent, is on subsidies for people. A big chunk of the money, the biggest chunk of the money, is to subsidize access so people can buy insurance. Another fairly big chunk is the expansion of the Medicaid program. So there's lots of federal money here to expand Medicaid. Your state is not taking that Medicaid expansion. So even though your tax dollars go to pay for the Affordable Care Act, you won't benefit from that because your governor and your legislature are going to turn that expansion down. But you will have access to the insurance exchanges. And how much support you get in premium will be a function of what your income is. If your income is 100 to 130% of the poverty level, you'll only have to pay about 2% of your income for health insurance. 100% of the poverty level is around $12,500 for an individual, incidentally. If you're at 400% of poverty, you're going to have to pay up to 9.5% of your income. And I'll show you some examples in a minute. But how much federal assistance people get will be a function of how much money they make. This is clearly a means-tested benefit. And if we look at you can see some of the examples here. Subsidies are based on the Silver Plan, which is essentially a $2,000 deductible plan for most people. It's a little less for low-income people. If you're a single person making $11,490, you're only going to pay 2% of your income. A family of four at 100% of the poverty level, that's a family of four making $23,500, would pay no more than $471 for health insurance. They would get a plan with about a $700 per person deductible and $2,000 in annual out-of-pocket maximum. Pretty good deal for low-income people. As we go up the charts, though, it starts to get a little more expensive. A single person making 250% of the poverty level, or $28,000, $29,000, will pay $2,300 a year for their health insurance. Now remember, employer-provided health insurance for a family costs about $15,000 a year, so it's a pretty good deal. If you start going further up the scale, it becomes much more difficult. A family of four making 300% of poverty, that's $71,000 a year, would have to pay $6,700 toward their health insurance. Now, on one level, that's a heck of a deal, because that policy is probably worth $15,000. But on the other hand, think about a family of four making $70,000 going to the insurance exchange and being told it's going to cost you almost $7,000 and you're going to get a policy with a $2,000 per person deductible. That's still going to be a stretch. Incidentally, Senator Kennedy, at the beginning of this whole process, introduced a bill that would have made these subsidies much more affordable for these kinds of families. It would have cost $2 trillion to pass that bill instead of the $1 trillion the Affordable Care Act cost. So again, it's the politics of reality. We weren't going to be able to pass a $1 trillion bill. And so we've got a compromise here. And the compromise is going to hit middle-income families the hardest.